The assessment and treatment of spatial neglect in stroke survivors. A pilot study in high-risk population at Newark Beth Israel Hospital, funded by Healthcare Foundation of New Jersey. Hidden disabilities affect many stroke survivors. Spatial neglect is a hidden disability that complicates recovery. Early detection and intervention may improve outcomes.
This particular grant with Kessler involves people who've suffered strokes, and of course that's usually elderly people, but not always elderly people, and who have a condition that has been up till now unrecognized by most professionals, and which hampers their ability to function in the world.
Something that may be surprising is that when people have this problem after right brain stroke and they have difficulty with awareness, with orienting, with computing the relationship of their body and the environment, that clinicians really have trouble identifying it. And what we've found is that even in specialized environments where people have a lot of experience with stroke, up to half or even 80% of people may not be diagnosed as having this particular problem. And we feel that that's understandable because a pathway that leads from diagnosis to treatment, especially one that was useful for people in the acute hospital environment, was not available. So what we're doing is really novel, and it's really a testament to the ability of the Kessler Foundation and the Newark Beth Israel staff to take a risk and come with us into a new set of processes, taking a leap of faith, really, that the processes that they've been using could be improved upon. And I think they've felt satisfied that they were learning and that their patients have benefited.
To diagnose and treat spatial neglect, Foundation researchers developed Kessler Foundation Neglect Assessment Process, KF-NAP, and Kessler Foundation Prism Adaptation Treatment, KF-PAT. Study goals: screen charts for patients with right brain stroke. Train therapists to assess for spatial neglect using KF-NAP. Train therapists to treat using KF-PAT. Gather data, analyze impact on outcomes.
I would like to know how many stroke patients in the most acute stage have spatial neglect. And if they have spatial neglect, can we treat them, in this very acute phase and then actually facilitate their further rehab?
We really saw how this research was going to impact people's lives almost from the get-go, because it was working with patients to show that this protocol really works, and then training professionals to do the things that they need to do to create changes in their patients.
Anyone who comes in with a stroke, acute or chronic, who has left-sided neglect and a right-sided stroke, is going to be considered for this therapy. It's not that everybody's going to be amenable to the therapy or everybody's going to be appropriate for the therapy, but everyone's going to be considered.
But using KF-NAP is to assess spatial deficits during activities of daily living. They can look at patients or assess patients from a different angle to help them to detect whether patients are prone to fall or not.
From July until December 2014, we screened about 400 charts looking for right brain stroke survivors. And if they had a diagnosis of right brain stroke, that would trigger the therapist to do the KF-NAP. So the therapist did 78 KF-NAPs on about 135 right brain stroke survivors, so over 50%, almost 60% were screened with the assessment, and we found 15 patients that had positive KF-NAPs or that spatial neglect was prevalent. And 8 of those patients were able to get PRISM treatment.
It's a great tool. It's been very significant, again, in that patient's ability with that left side neglect when they become, again, a patient safety awareness problem, a neglect problem, the ability to tend to that left side has been greatly improved. And again, early intervention. The earlier we get to patients with this kind of problem, the better outcome we're going to have, the more functional the patient's going to be.
At Kessler Foundation, we have developed a therapy procedure to treat spatial neglect. We call it the Kessler Foundation Prism Adaptation Treatment, or the KF-PAT. In this treatment, patients perform arm movement toward targets while wearing these prism goggles.
16 therapists were trained in assessment and treatment for spatial neglect.
It could be applied pretty much anywhere without really having to buy very expensive equipment for it. So I thought it would be a good thing for everyone, really. And that's why I got excited about it.
If we can't get our patients home or to a rehab facility or to loved ones in a way that's safe, then we haven't done them any good. And so helping them recognize that there's a whole left side that they're neglecting is not only useful because they can prepare food and see the food on the left side of the plate and brush their hair on the left side, but because it keeps them safe. Imagine driving a car and only seeing from here over. Doesn't sound too safe to me. And that applies to everything that we do, to walking up and down stairs, to taking a bath, to driving a car, to preparing something on the stove. These are all patient safety issues. And those are the activities of daily living that we need to incorporate with patient safety that make our patients' lives meaningful and have quality again.
This has been an opportunity, I think, to understand how to bring an early rehabilitation process to an acute hospital. And as far as I know, this has been a unique venture, especially in the area of right brain stroke and right brain stroke rehabilitation for this visual problem, spatial neglect. I do not know of any other hospital settings in the country where immediately in the days after stroke, people are being assessed and potentially treated.
The work that the Kessler Foundation is doing is priceless.
Next steps. To analyze this study's data, looking at the long-term impact of diagnosis and treatment of spatial neglect on recovery from right brain stroke. Publish articles on study results and feasibility of inpatient implementation of KF-NAP and KF-PAT. For more information about stroke research at Kessler Foundation, visit kesslerfoundation.org. For more information about the online KF-NAP and KF-PAT training course, go to www.kflearn.org. Alone we can do little. Together we can do so much more. Helen Keller. Thank you, Kessler Foundation stroke researchers and Newark Beth Israel staff, for all that you do to help our community.